our dark torso model. We have a lot of terms on here, so I'm going to try to hit all of them. We first, if we start at the top, get the superficial temporal artery. And we have the facial artery and vein. Now as we go down into the neck, this very superficial vein is the external jugular vein. If I rotate this towards you, so I'm going to go down to where the vessels are coming off of the heart right here. So this is the superior vena cava. We get that superior vena cava branching right here into the brachiocephalic veins. And then once we get this branching over here, we get these subclavian veins. Remember, think about that name, subclavian, under the clavicle, which is right here. And then we get the internal jugular veins. So there's one right here, and there's one there. Now, as for the arteries you're seeing here, this is the aorta, or the aortic arch. Now, on the right side, we're going to get a trunk that's going to split. This is the brachiocephalic trunk, or brachiocephalic artery, either is acceptable. The branch that's going to go up the neck is the right common carotid artery. The branch that's heading towards the arm here, that is also underneath the clavicle, that is the right subclavian artery. Now the left ones do not have a common trunk. So right here, coming straight off the aorta, we've got the left common carotid artery, and then the left subclavian artery right here. And if I rotate this a little bit and move our heart, you see that that aorta is going to continue down, descend through the thorax, and it's then going to descend into the abdomen. Before we leave our thorax here though, this gray bit, that is cranial nerve 10. That is your vagus nerve. And notice it's got branching coming over the arch of the aorta. I'm going to move our heart out of the way now to capture a few other little things in here. So this is the hemiazygos vein. Hemiazygos is on the left, azygos is on the right, but in this model, that lung is obscuring it. We also have here, notice that they're right alongside each other between the ribs. We've got an intercostal nerve, intercostal artery, and intercostal vein. And then in our lungs over here, coming to and from the heart, the blue one on top, that is a pulmonary artery. Don't get thrown off by the color being blue. It's representing oxygenation. The red one here is a pulmonary vein that's going back towards the heart. Now if we move down into the abdomen here, so like I said, we have the aorta continuing right here, and this is the inferior vena cava. Both of them are going to split like an upside down Y. So each of these branches is a common iliac artery, and each of these branches is a common iliac vein. Then each of those common iliacs is going to split again. So it's another upside down Y. You can see it pretty well right here. This one that stays more superior, that is the external iliac artery. External iliac vein is right next to it. And then the ones that are diving down more into the pelvic cavity are the internal iliac artery and vein. We've also got here a nerve. This is genitofemoral, sitting on top of the psoas major muscle. And then we've got some branches here. So first of all, I'll start with the inferior vena cava. It's got these two branches that are draining into it. Those are the renal veins. That mean, renal means kidney, so they're coming from the kidneys. You can see that right here. The arteries alongside of them going towards the kidney are the renal arteries. We've also got a suprarenal vein and a suprarenal artery right here. These are the suprarenal glands. So these are the artery and vein that are supplying blood to and draining blood from those organs. Now right here, this may look a little confusing because we've got 3 branches right by each other. What all those branches are coming from, so about here in the middle, you have the celiac trunk. This branch on top coming from the celiac trunk is the left gastric artery. The one that is on the right side, right here, is the common hepatic artery. And the one on the left side is the splenic artery. Remember, you always want to identify right and left based on anatomical position. So think about it as though it's you. This branch coming off the aorta right down here is the superior mesenteric artery. We've got a branch down here that is the inferior mesenteric artery. And then we've got a paired set of arteries right here. Those are the gonadal arteries. So if the individual has ovaries, those are actually the ovarian arteries. And if they have testes, these are the testicular arteries. Here is the gonadal vein on that left side. Here's the gonadal vein on the right side. Notice that they're going to drain into their next veins in a different place. So left gonadal vein is going to drain into the left renal vein, whereas the right gonadal vein is going to drain directly into the inferior vena cava. Now, as we move a little bit further down, we can actually see the femoral artery and vein right here in the bottom.